I'm grateful to be here tonight. My experience in Ghana has been a tremendously good experience. I enjoy going there except for the long flight. Once I'm there, it feels really good. The people of Ghana are wonderful people, very friendly, eager to learn. This is my biggest impression of all of our students there. When we were looking and talking about setting up the dental school there, we asked them, do you want us to gear our curriculum or our presentations to what your country now has and needs, or do you want us to gear them to what is current in our country, where, you know, the most recent and up-to-date information? They said, we want the most recent and up-to-date information that you can give us. And so that's what we've done. And I tried to be cute by saying, by titling this, Dentistry is Open Wide in Ghana. But it is a very progressive nation, and they are eager to meet the oral health needs of its people. With that eagerness comes significant problems, which I think, as Scott said, are related to public health issues. So the University of Utah already had a global health initiative in medicine going to Ghana on a regular basis. And in 2007, I was contacted by Devon Hale, who said that Ghana is requesting someone from dentistry come and help in the formation of a new dental program there. And the primary interest would be a collaborative teaching in oral health at the KNUST University, but the location was in the CAF Hospital in Kumasi, Ghana. So here we are with our first meeting to meet the dean of the new dental school. He was formerly working as an associate dean in the dental school in Accra at it's called Corlevu. And he had been assigned to come to Kumasi and establish a dental school there. The problem they were having was when the students were educated in Accra and graduated, they would tend to stay in Accra. And at that time, a man by the name of Anthony Asari, who was over the health program in Ghana, said, we've got to put a school more central in Ghana so that the students will be more inclined to also be willing to serve in that area in oral health. And so that was the primary purpose for the new school in Kumasi. They met with some resistance from the existing dental school, who felt like another school wasn't needed. It sounds so familiar to what we've been through here. But this was a great meeting. I happened to be able to travel there with some of the faces you might recognize, and had an enjoyable trip, because these are seasoned travelers, and they were there to do some ER training for doctors and nurses at the Kumasi CAF Hospital. They had not yet finished the new trauma center, which is now in Kumasi and serves their entire nation. 74 million euro, I think, was what that trauma center cost, and it's a wonderful facility. We were privileged to stay at the guest house on the KNUST campus. Very comfortable, running water, hot and cold, and indoor toilets. Those are some key issues for depending on where you are in Ghana. But this was very nice. They also had a nearby restaurant. And this is the first class of students at the new school. There were 8 of them. If you count, you'll see a 9th person right here. His name is Dr. Patrick Karikari, or we say Patrick Kakari. He was the assistant administrator at the CAF Hospital when all of this was taking place. He was also a dentist and was instrumental in getting the dental school organized and ready to begin. What developed then was the dental school building that we use now for our training actually was a remodel of his hospital administrative offices. And when they opened the new trauma center, then that building belonging to the hospital was then free to remodel into the new School of Dentistry. I might just say that, again, very eager students, eager to learn. You might recognize Dr. Morton here. He was there on that trip. This young man was a pre-dental student whose father actually shares office space with me and Logan. And he had been to Ghana on an LDS mission. And he asked if he could accompany me on this trip. This is the following year from the first view. And he was good to have along for my sake because he knew his way around. And that was very helpful to me. The Ghanaian English is English. And so this lady we'll go back. This lady right here, her name was Esther, but she told me it was Esta. So I literally called her Esta for 2 days before I realized I was not speaking correct English for them. But she was like the class president. Here again is a picture of Dr. Kakari presenting Dr. Morton with his name on it, some kente cloth in appreciation for his teaching during that week of gross anatomy and neuroanatomy. Yes, please.
How many applicants did you have for that first class?
I don't know. I have no idea. In their system is a 6-year program. When they graduate from high school, if they're qualified, they enter into a basic sciences regimen that goes for 3 years. At the end of that 3 years, they divide out medical school from dental school, and these students are now technically beginning their 4th year, or they were at this time, excuse me. But I honestly don't know how many applicants there were. In fact, my impression is more that they're accepted rather than apply. Here again, we are now in the, it's called the Phantom Head Lab. A lot of the teaching is done using these mannequins, enabling the students to get some experience before actually seeing patients in the clinic. Again, just wonderful students, eager to learn. You know, my wife tells me I have a hearing problem, and these students, I think it's out of respect, they speak very quietly, and I've actually asked them to please shout so that I could hear what they're saying. I have to almost get my ear to their mouth to hear because they're very quiet when they talk. Here's a picture of the remodeled area, all of the clinical that's not working. All of the clinical procedures, the dean's office, an instruction lab, and that Phantom Head Lab are located in these offices on the left. The dean's office is very adequate, but it's not lavish. It's just a nice place for him to meet and to instruct. This was the day of inauguration for the new dental school. And this group of people represents the accountant, the architect, several of the engineers. Here's the new dean here. Dr. Ankra, Gilbert Ankra, is one of their primary dental educators. This lady here is the clinical supervisor. Wonderful first name. Comfort is her first name. It's interesting to have her in the dental program. I should have said comforting to have her there, I guess. Here's Dr. Ankra. He actually practices in Accra and then comes up to Kumasi 1 week per month to do his portion of the instruction for clinical areas in dentistry. This is he and his family. I put this in just to remind me of a couple of things. His wife was suffering that day from malaria, or what do you call it, flare-up, and has had it off and on for years. And it made me appreciate what patients who've had malaria and still have it suffer through, because she was not feeling well at all that day. The other thing I wanted to mention was in building this house, it took them 10 years before they were even able to move into the house. In Ghana, a loan for a house or any other building, if you borrow from the bank, is about 28% interest. It doesn't even compare. So what they do instead, with each paycheck, they'll buy enough blocks or bricks and mortar to continue to add to their home. After 10 years, they had the roof on so that they could move in and start living there, and then they finished it later. Very nice home, but it's very common. Dr. Morton has told me of one of the doctors in the medical program. She and her husband just moved into their home last year after 20 years. So we buy our home on credit and pay it off over 20 years. They build their home and move in after 20 years. But they have no debt, and that's a good thing. Here we are in the Phantom Head Lab again. They have some very nice equipment that's been donated to them, and these were used to project some of the information we were giving on using a dental rubber dam. Unfortunately, because it gets moved around a lot and a lot of use, this is no longer functional. Some of the cords have broken, and they don't have anyone who knows how to repair them. So this technology gets lost quite quickly. This is the third class. I'm sorry, this is the second class. They call them batch, the second batch of students. About 50-50 male, female, and just, again, exciting group to work with. From a dental standpoint, it is very exciting to take an impression of their teeth or to look in their mouth, because they almost all have their wisdom teeth fully erupted in perfect alignment in their mouth. Their, I guess you'd call it, their gene pool has not been combined with other pools, so it's a very pure genetic group of people, and their jaw size and their tooth size match. And so you can get third molars in perfect alignment. It's marvelous. This lady right here, her name is Maria. Her arch is probably this broad as compared to ours, which is maybe 2/3 of that. Perfect alignment, just a beautiful smile, a beautiful person, beautiful from a dental viewpoint mouth. When I went then, it was right after the university had finished its remodeling, and I picked up a bunch of these t-shirts before going, and I just gave them to the students as a gift on the second to last day that I was there. Well, every Friday is called the Ghanaian Way Day, and they can dress in their whatever they choose. They do not have to dress in formal university dress. So they chose to wear these shirts that I gave them, and I was honored by that. This is Dr. George Bailey. He's a periodontist, and he came there on my third visit and gave a much-needed lecture in periodontal health. And this is that one where it has the embedded. Is there a way to play it? It'll just show you mainly where his lecture was given. It's a different area than the Phantom Head Lab. There we go. So there's not a lot to hear, but if you look now, you can see the first-year students now in their, this would be their second year, and this is the lab and lecture area in addition to what you saw as the Phantom Head room. Yes.
So again, that's the first year after the first 3 years.
No, this is now their second year of the dental program. So they are what we would call juniors. Yes.
I was curious, where are these instruments and tools made, and who donates them?
Like what you're seeing here was purchased. These are Cavo, and they're German made. The impression materials that they use, which I really liked, are Italian made. The rubber dam materials I took with me to use to teach because they didn't have them, and they had never been able to really teach that to any of their students because they didn't have the materials or the instruments. One year with this group of students, I went and we were supposed to practice doing composite tooth-colored fillings in the Phantom Head Lab, and they asked me if I wouldn't teach that because they needed that material in the actual clinic. They had run out. And at that time, the hospital who funds their program was not funding them very well, but by the next year, the hospital learned that their program creates an income. And so then they really kicked in and started to fund them, and they've got most of what they need now. So they are very welcome in the CAF hospital. Students will gather around, I'll demonstrate, and then they'll go to their units and practice, and then I'll go around and check and see what their work looks like. Here are some practice preps that we did on some plastic teeth mounted in dental stone. I would show them the form that it would take or needed to take. We've talked about decay, where it is located, and how to eradicate it, and how to prepare the tooth for a filling. And then later, the tooth would get an amalgam filling placed in it. That's still the best material as far as longevity and being inexpensive. It just isn't quite. Here's some more in one of the clinic areas where they have 6 operating chairs where they can see patients. We're just training here on some concepts of diagnosis and treatment planning. This is the rubber dam that I was talking about. Some of you may go to a dentist who uses these. They're excellent for protecting the patient and for visibility for the dentist, although I did have a lawyer who thought that you should turn the name around. This is an example of a crown prep that we taught them how to prepare a tooth for a cap or a crown. Then we also taught them how to do a provisional or temporary crown that would fit over that. And my pointer's not working. It's the one that's a little darker yellow color. Here's Mariah again. That was her work. She was one of the best students in the group. Did excellent work for the very first time of ever having to prepare a tooth for a crown. This is the new group last year, so it's their 3rd year group, a smaller group than normal. This lady here is from Nigeria. And to your question about how many applicants there were, again, I don't know why they had a student from Nigeria in their program, but that's something I need to find out about. We were trying to transfer information from my lectures so that they would have them there and could review them. And this student here, his name is Enoch, brought out his PowerBook Mac. It was brand new. It was brand new. And he was able to Bluetooth across and get the information from mine. And so they now have that available. And he made it available to their students. He got it by flying to Portland, visiting his brother there, and while there he got his computer and took it back with him. Excellent students, fun to work with. One of the biggest challenges, is the manpower shortage. In 2006, the population was 20 million, and there were about 120 dentists. That calculated out to 1 dentist for every 166,000 people. A typical U.S. dental practice does well with 1,500 patients. So that would, what, be 1/100,000th of that? It's pretty amazing. So it's impossible for the dentist to see all of the patients. And so Ghana has adopted programs to try and create what are called mid-level providers, one of which is called the COHOs. I think when Dr. Ajasi was here, he spoke to that. They're the community oral health officers, and they have to actually go to school for 4 years, or they're in a program for 4 years to train to do this, but it's very limited what they can do. They're basically monitoring the oral health of the community. If they see anything that is serious, then they'll refer those to the nearest hospital where there would be a dental surgeon. They're also looking at and plan to instigate this year another dental therapist level program. So a coho could spend 4 more years and get certified and a bachelor's degree, which would give them a significant increase in salary from the government who pays the salaries of these mid-level providers. But they would be then allowed to extract mobile teeth and place sedative fillings in primary teeth on children. So that would at least meet a significant area of need that is present in Ghana. This is the comparison between the 2000 and the 2010. Michelle?
I was just going to ask, so are they learning like preventative stuff like sealants and prophylaxis and things like that?
They are. They're learning it, but not allowed to do it yet. Yeah. So there's quite a bit of control on that and concern with the dentists that if we train these mid-level providers, who's going to supervise how much treatment they really do? And that's where the blockade seems to be. But the hope is that there will be enough benefit to make it worthwhile as more dentists are graduating. Because they now have Korle Bu graduating dentists, and they have Kumasi graduating new dentists. The dental, size of the next dental class will be 22. Up until now, the largest we've seen is 13. The one following that will be 44. And these are directives that are coming out from the Ghanaian government in the Department of Health saying we need more dentists, we've got to train them. The biggest problem is where do we train them? And so that area in the CAF hospital will be remodeled again to include another broad area of that same floor as those people there, which it's a pediatrics clinic, they will move into a new hospital area. So you can see here that your census from 2000 grew from 18 million to 24 million. It's a 30% increase in population over 10 years. The other problem that is there now, though, is even when we do get more dentists, there aren't that many facilities where they can practice. They don't have the income to build their own facility, and so there's kind of a concern of what will happen to all these new dentists when they get out and have nowhere to work. Tony Asari, again, who was the one who thought of putting the dental school in Kumasi, also has had the concept or hope that they will be able to get interested investors who will be willing to build small 2-chair clinics all over Ghana and sign these students after they finish dental school. They go into a government program in hospitals and community centers where they serve for 1 to 2 years. But as soon as they complete that service, the thought is let them contract to practice in these small clinics and over time slowly pay off the amount that is owed on the clinic. So they would eventually become private owners of their own dental clinic in the areas where they're assigned. Yes?
How do patients in Ghana pay for dental work?
That's a very good question. The economics of Ghana are kind of a mystery to me because on the one hand, I've followed a Porsche Cayenne. While I was in a taxi, we were driving behind a Porsche, and you see Mercedes-Benz. On the other hand, a lot of people are walking. So you have a lot of poverty, and then there's still an upper class of income. Those are probably the first group that will get access to care as far as being able to pay for it. But I'm thinking that there will probably become some kind of a reimbursement through the government that will help fund some of these practices. So if you could build the building and get the dentist in it, then the patients would qualify for some reimbursement. That's just my take on it, and I'll have to admit it's very uneducated. We're working with the head of the dental oral health in the Ministry of Health to get more information on how this is all going to work. So this is the portion about the idea of setting up these small clinics for the dentists as they get out and are ready to take over private practice. I think it would work if you could find the investors, and that's where the logjam is right now. There are just some problems in the oral health that you see in patients in Ghana that because of lack of facilities and lack of supplies, these cannot be treated. I was asked to see this patient just to get an idea of what might be going on, whether it was dental or not. But you can see that one half of his face is fairly normal. The other half is quite enlarged. I brought these pictures back with me and showed them to the tumor board here at the university, and they say this is an overproliferation of veins and blood vessels in that area, and that this could be treated by injections that would shrink them, but the materials aren't available in Ghana. It's not a surgery from what I understood in their explanation. But in looking intraorally, he has a perfectly normal, healthy process in his mouth. He doesn't even have decay. He just lost a tooth down here. A new one is coming in. He's 10 years old. And so we were just checking to make sure that there was no oral connection to what he was suffering from. This is a poor slide for a number of reasons, but this is in a 12-year-old patient. These are brand new cuspids coming in, but he had this mass covering this primary molar back here. This was at a health day that we had at Kintampo at a nearby village. And so that there's another view of it. That was extracted. And if you look closely, you can just see the cusp tips of that molar. There's one there, and there's one there. The root is down in here somewhere. But this was all, as near as we could tell, calculus or tartar that had formed in that area. There's a salivary duct that empties right there. And for some reason, there was some debris on the tooth over time that seeded this accumulation of tartar. So removing that helped to restore normal, or will restore normal development of the permanent teeth and the gingival tissues. This is the Oral Health Training Center at Kintampo, and it is about 100 kilometers further north from Kumasi. This lady right here is the Chief Dental Officer for Ghana. This lady here was in charge of the clinic. She has since left, and this gentleman is now in charge of it. She was trained in England. Dr. Ankra was trained in England, in Manchester, England. Very good dentist. This gentleman here is an oral surgeon right here. And they were there, and we were reviewing their plans for the dental therapist curriculum so that they could train and, in my opinion, overtrain these people to become limited mid-care providers. This was an international symposium. It was their 6th year of holding this, and it was given for physicians' assistants throughout Ghana and some neighboring countries. And my purpose in being there was to talk about oral health and raise the awareness of the physicians in the area to look at the teeth and the tongue and the gum tissue as they're going back to look at the tonsils. This is the core value sign inside that clinic, defining their purpose, what they're hoping to accomplish, being people-centered and professional, having teamwork, discipline, innovation, and excellence, and integrity. It's all very lofty goals, and they do that. That is their purpose. Again, talking about oral health, this is another sign, and I don't know if you can see this very well, but right here, so they have floss and they have toothbrushes and toothpaste, but right here, these are wooden sticks, and they call them chew sticks. And what you do is you start chewing on it, and the wood shreds and becomes kind of like a wood brush. And they're encouraged then to use that to scrape the plaque off of the teeth and clean the teeth so that infection doesn't form in and around the gum tissue. Yes?
I've seen these been used. Are they just any type of wood stick?
No, they're not. They're, I don't know what kind of wood it is, but I know that when you start chewing on it, it sucks up the saliva, and then it starts to shred and becomes little bristles. And it's very effective, and it's very cheap. So it does help them do some cleaning. This was the health day at the village. These people here are dermatologists who went to Quintampo to that meeting to give presentations. Here's a lineup of children waiting to see the various physicians and dental students and myself while we were here at this village. The chief of the village was very grateful, and he donated a goat for our celebration dinner on the last day that we were there. And we had what's a very typical Ghanaian dish called goat stew, and you know, it's good, and we enjoyed it. But that was his gift for the day that we spent there. I thought it was very gracious. Here is one of the students in training. He's giving a presentation to these children on home care. I love this picture for a number of reasons. You know, it's interesting that the people who live here come out of homes and walkways that are just dirt. And yet when you see the children in their uniforms or the mothers in their dress, they're immaculate. They're beautiful. The clothes are clean. The children's clothes are pressed. How these mothers do it, I just don't know. But it's amazing to me. But look right here. Do you see these little eyes? That was so cute. She is very much under that mother's wing. But we were seeing one of the other children, and before we would do any procedures, we always had a parent sign that they gave their approval. The other interesting thing is this lady spoke a different dialect of Twi, which is the Ashanti language in Ghana. And so there was only one of the students who could understand what she was saying and communicate with her. That's also a priceless picture, in my opinion. These are the people who will benefit most from the mid-level providers for now. Here we are again with that first group. I brought this up because I wanted to show you this picture at their graduation and when they received their diploma from dental school. So I think that's a really great statement about the accomplishment to this point of the school, and it will continue to grow. You're getting, in my next trip in July, a pedodontist will go with me to give lectures on treating children in dentistry. And we're planning to lecture both in Accra to the Dental Association and then also teach in Kumasi to the students. This is a photo that I took from the hallway that we saw of the dental school. If you look out those windows, this is what you see at about 6 o'clock in the evening. It's a very beautiful view. I love Ghana in July because the temperature is right about 85 degrees and it's not stormy. It's just the perfect time of year for me. I threw this in. University of Utah actually spent 3 months, or at least this is the story I've been told, the account I've been told, studying this lake and concluded that it was a lake that was formed by a large meteor strike. It's in the deepest point, it's 145 feet deep. It's the only natural lake in Ghana. All the others are dams, but it's Lake Balsam Tui. Do you like tilapia? You enjoy that? When we were here, there were fishermen on what represented mostly a log out in the water, and they had nets, and they would catch these little tilapia. It was about the size of these 3 fingers, and they would bring them in and clean, or just make a slit in the abdomen and clean out the insides, and then throw them into a frying pan and eat them just like we eat potato chips. It was really interesting. But a beautiful, beautiful place. Another one of the beauties of Ghana are the flowers that we saw while we were there, and I had to get a few pictures of that. And that's it. I hope that's been informative. It's a limited view because I've only been to Kumasi, but it at least represents what the University of Utah's dental program is doing now in Ghana, and a picture for where we intend to go forward from here.